main responsibilities as a medical assistant. Main responsibility is first and foremost to assist the provider, but also taking care of the patient in the office.
Rooming patients, getting their histories.
Vitals, medications, questions from patients when they call in the office.
As an MA, we have so many responsibilities. We can work front office, which is where you usually check in patients, answer telephone calls, schedule appointments. You can also work back office, which is more so clinical.
Maybe doing any other tasks like EKGs, injections.
What's something surprising about your job that most people wouldn't know?
I guess the things that patients tell you, you don't really expect some of the things they tell you, especially with children, teenagers, even adults, and like what's wrong with them or how they describe it. So you just kind of have to be prepared for whatever's going to come out of their mouth without having a reaction. You know, you just kind of have to stay calm.
We can do the same thing as LPNs in the state of North Carolina, except for starting IV or discontinuing an IV.
I think a lot of people do get confused with what a medical assistant does. I can give you an example. My son used to tell me that the only thing that I did was bring a patient to a room. I would ask the pain level 0 to 10 and say the doctor will be with you shortly. So of course we do way more than that.
Why do you want to help people by working in the medical field? And it's rewarding. I enjoy coming to work every day. I enjoy the people that I work with. Being there for our patients is one of the most important things that we can do.
I've always felt that my gift is service. So I love helping people. I love to take care of people. I love caring for the staff and the provider that I work for.
Me personally, I feel as though I was shaped and molded for this job. I was very close to my grandmother. She was a diabetic and I helped her every way that I could. And once she passed, I just really wanted to continue helping people. I love what I do.
I've always been kind of drawn to helping people. I worked in a pharmacy before I went to school, and I like helping people.
What is the best way to get experience in the healthcare field in high school? The best experience would be to take any health science classes that are offered at your school. Maybe they're offered at a different school that you can also jump in on.
You can volunteer at the hospital. Sometimes schools will do a sports physical drive at school.
A lot of schools now have challenger programs and things like that where they offer CNA classes. You'll get to go into an office a lot of times, into an office setting. Organizations have like a medical explorers program, meetings at hospitals, and they'll bring directors and things in to explain different areas in the hospital that you may be interested in learning.
Even the community colleges in your area, you can become a dual enrolled student junior and senior year and begin taking college courses. How do you make patients feel comfortable when they come in for an appointment? With my patients, I greet them with a smile. When I ask them a question, I listen attentively. I let them say everything that it is that they need to say.
I'll just ask them how their day is, just kind of shoot the breeze with them and just kind of try to make them feel comfortable. Tell them I like their shoes or whatever, you know, and just kind of talk to them.
Being friendly, being kind, being compassionate and caring. I think from the front door to when they're walking out, that's very important.
I always make eye contact with my patients. I'm always smiling. I listen to what they have to say and try to get maybe a couple moments of personal time too. Ask them about their family, ask about their pets. That's the one good thing about seeing patients over and over again. You get a relationship with them.
Can you share a story about a moment you felt you made a difference in someone's life? Just listening to people when they talk. It doesn't matter what they're calling you for or doing. Knowing that what they're saying to you is important, you're going to help them no matter what.
Many responsibilities is medication refill requests. I had a patient that needed their insulin refilled, and we had sent the medication into the pharmacy, but when the patient went to the pharmacy, they kept saying it wasn't there. I spent the day on the phone with the pharmacy, making sure that the patient got the insulin that they needed. I definitely stepped up and I was the advocate for the patient.
Making a difference was going the extra mile for patients. So if I had a patient who couldn't fill out their paperwork or who needed help getting a medication and they didn't know what questions to ask the pharmacist, I would always just try to go the extra mile for my patients to make them feel like I did care and I could get what they needed taken care of.
We had a patient come in and she didn't really have anything. She had just kind of moved to the area and we had a bunch of food left over. So we decided to pack it up and give it to her. We gave her everything we had. We had snacks in our drawers. We gave her all that. Plus we gave her the lunch leftovers that we had. And she was very grateful. We put her in touch with someone from our care transitions team who is also a part of our organization. She could to help her nail down a place to live and help her with utilities and stuff like that.
What's something you enjoy about the variety of tasks you handle? My whole entire career has been with family medicines. You're going to see a different patient. You're going to see a different problem they have. So that was very interesting. It's never boring.
I think you get to see new people every day. In remembering them, that makes them feel important too.
When I draw blood or when I give vaccines and shots and things, I love when the patient says, that didn't hurt, that did not hurt at all. So that makes me feel really good.
How do you practice self-care as someone in the healthcare industry?
I know that self-care is very important. I take multivitamins.
I do go to the doctor regularly. I have my lab.
As a medical assistant, I always will use the personal protective equipment as needed with patients. I try to stay healthy. I eat healthy, try to exercise, but also I'm a big advocate for vaccines. So I take whatever vaccines are recommended to keep me healthy.
How has this job helped you grow as an individual?
This job has really helped me realize that I would like to move on and become a registered nurse. I can do a lot being a registered medical assistant, but can do a lot more as a registered nurse. I might even go on to nurse practitioner.
So every day is a learning experience. I learned something new about our computer system, or I learned something new about screening opportunities for our patients. So I'm always growing as a medical assistant, which I think helps me be a better medical assistant all around.
I've been doing this for almost 30 years. And I feel like when I first started out, I was very shy, the least amount that I could, and kind of got out, didn't really talk much. And I'm not that way anymore.
What advice would you give someone interested in pursuing this career? If you are a people person, you love to care for people, you want to help, a medical field is a great way to do that. There's always something that you can do, always involved. A medical assistant is a very important part of the medical team.
Do it. Keep going. The sky's the limit. No matter what your age is, just go for it. And the healthcare is growing every day. It's a great field to have as a career.
Do whatever you want to do. Go explore and go to school and, take that leap.
If you know that this is what you want to do and you love helping people, commit to that, make a plan, and follow that plan through.